In Money Watch, as more businesses require employees to be vaccinated, many Americans are now seeking medical exemptions. But as Money Watch reporter Megan Cerullo explains, getting approved for a medical exemption is no easy process, especially now that the FDA has fully approved the Pfizer shot. Megan joins me now to discuss. Hey there, Megan. So can you explain how exemptions from a vaccine mandate works? Is it a matter of getting a doctor's note?
Hi, Lana. There are two groups of exemptions from mandates. Workers can request religious exemptions and medical exemptions. There are no known medical conditions that interfere outright with vaccination. So workers have to very specifically document what it is that makes them ineligible for vaccination, and they can then request an accommodation from their employer.
So what are some of the medical conditions that might make someone ineligible for vaccination, and what conditions don't apply?
There are no known medical conditions that interfere outright. There are no contraindications other than severe allergies to given vaccine components. So anyone who had a severe allergic reaction to a first dose would be ineligible, or anyone who has a documented allergy to a known vaccine component. What's interesting, though, is there are 3 vaccine alternatives. So it's very unlikely that someone would be allergic to all 3 vaccines, and their reaction has to be severe. A lot of us had a sore arm after receiving our vaccines. A worker would have to show that they had trouble breathing, for example. That would qualify as a severe reaction.
And the other part of that, we've heard people say that they don't want to get it because they are pregnant, or they would like to get pregnant, or they have a peanut allergy, and we know from the doctors that we've spoken to that they believe that people in all of those categories should in fact get vaccinated. Are there any other excuses that people are trying to put forward that simply don't fly?
Right. You asked what conditions would not qualify an individual for medical exemption, similar to the religious belief exemption. Simply saying, I believe in God is not going to get you an exemption. Saying you have a peanut allergy is irrelevant because there are no peanuts in these vaccines. Individuals who claim that they're worried it'll affect a pregnancy or harm their fertility. Those are also myths that have been debunked by large studies. So that's not going to fly.
So if you are in the very rare case where you actually do qualify for a medical exemption from the vaccine, can employers still mandate testing, mask wearing? Is there any limitation then once you get an exemption on other conditions that an employer can put on you to make sure that workplace stays safe?
It is important to note how rare these medical exemptions are. Under Biden's rule, for example, companies that employ 100 or more workers must require vaccination or else require workers to test weekly. So an individual who does not want to take the vaccine for whatever reason, religious, medical, or otherwise, can instead decide that they want to test weekly. However, companies have the right to set the terms and condition of employment, and if a company does have a true vaccine mandate with no testing option, if a worker does not qualify for a medical exemption or a religious exemption, they can be terminated legally.
Well, that was what I was going to ask, that if people refuse to get vaccinated, don't have a valid exemption, whether it's religious or medical, does the employer need to do anything else, or can they just say, okay, sorry, this is the end of the road for us?
They can. If there's no built-in accommodation like testing and the worker doesn't meet the threshold for receiving a medical or religious vaccination, the company is within their right to fire that employee.
All right, Megan, thank you.
Thanks, Lana.